Hi, this is Dr. Mark Hyman. Are your food allergies making you fat? Your digestive system may be making you fat. It's hard to believe, but very true. Today I'm going to explain how the bugs in your digestive tract and the way they upset your gut's immune system just might be behind those extra pounds. I have observed this phenomena in hundreds of patients. Recently, remarkable new research has confirmed this phenomena, and I've developed very effective treatments for it based on understanding the way in which all the body's systems, the gut, immune system, detox system, hormones, and more are all connected. There's powerful evidence that addressing these key causes of weight gain and illness can help you shed pounds. For example, I've seen patients who lose significant amounts of weight just by cutting food allergens from their diet. I've also seen people lose 20 to 30 pounds by simply balancing the bacterial ecosystem in their gut. One patient, a 38-year-old woman, had chronic inflammation, fluid retention, acne, fatigue, joint pain, as well as irritable bowel with bloating and gas. She tried almost every known diet but was unable to lose weight. This woman's problem, she could not lose weight because she was inflamed. Imbalances in her gut and the food sensitivities that results led to inflammation. But when we had her eliminate the foods to which she was allergic or sensitive and gave her some healthy bacteria to heal her gut, she lost 35 pounds in a few months, and all of her other symptoms went away too. The big debate in medicine is which comes first, inflammation or obesity. I've always believed that we become inflamed first and gain weight second, which makes us even more inflamed, perpetuating the cycle. Now, incredible new research bears this out. In today's blog, I want to review this research, explain how food allergies can lead to weight gain, and provide you with 3 steps you can take to eliminate foods you may be allergic to and rebalance your gut ecosystem. Let me tell you more about these studies linking inflammation and weight gain and explain their implications for treating obesity, heart disease, diabetes, and more. Both studies were done in Europe, where researchers are generally more open-minded. The first study was published in December 2007 and looked at 2 groups of children. The first was overweight and the second was normal weight. The researchers measured 3 key factors connected to inflammation. First, they looked at a marker of inflammation called CRP that shows a general level of inflammation in the body, or C-reactive protein. Then they looked for plaque or thickening of the carotid arteries, the main arteries that supply the brain, with an ultrasound. And third, they looked at blood tests for IgG, or delayed food allergies. What they found was startling. The overweight kids had a 3-fold higher level of inflammation with the high CRP, 2.5-fold higher levels of antibodies to common foods in their blood. This is astounding, since in most medical studies a difference of 20 to 30% is significant, and in these cases we're talking about differences of 300 or 250%. The overweight children had also much thicker carotid arteries, which were a sign of early atherosclerosis, an indicator of heart disease. The study suggests that these foods are a cause of the inflammation and obesity, not a consequence. The authors of the study explained that damage to the gut can lead to a leaky gut, allowing food particles to be exposed to the gut's immune system. This then triggers a system-wide immune response, leading to inflammation all over the body and producing obesity by increasing insulin resistance. We already know that inflammation from any cause, bacteria, food, a high-sugar, high-fat diet, will produce insulin resistance, leading to higher insulin levels. And since insulin is a fat storage hormone, you store more fat, mostly around the belly. The authors of the study go on to say that we should consider eliminating IgG food allergies as a way of treating obesity and heart disease. That means you just don't limit calories, just allergic foods that cause inflammation. This study draws a remarkable link that's received little attention by conventional medicine. So what exactly causes a leaky gut? Well, let me explain in the next study. The researchers of a study published in Diabetes in July of 2007 performed a complex but powerful study to tease out which comes first, the chicken or the egg. What they did was actually quite ingenious. They took thin mice and they fed them a very high-fat diet. High-fat diets change the bacterial flora in the gut, and then toxin-producing bugs are promoted by the high-fat diet, while anti-inflammatory and protective bugs die off. And there are over 500 species of bugs in your gut, all fighting for territory. In fact, our highly processed, high-sugar, high-fat, low-fiber diet, plus many drugs like antibiotics, steroids, anti-inflammatories, acid blockers, and hormones, completely alter the bacterial ecosystem in the gut, leading to breakdown, inflammation, and a leaky gut. Now, back to the study. The researchers found that the mice fed the equivalent of an American diet produced more of a bacterial toxin called LPS, which then leaked into the body through their leaky gut. In humans, these toxins then latch on to immune cells, stimulating to produce a firestorm of inflammatory molecules, such as TNF-alpha, IL-6, or IL-1, which are called cytokines, which in turn then block metabolism and produce insulin resistance, fatty liver, and obesity. Even more interesting, the researchers also found that even with a normal diet, injecting LPS into the same mice led to the same problems: inflammation and obesity. These mice didn't eat a bad diet, just injecting toxins into them from the gut made them fat. In fact, when you eat a bad diet, the bad bugs flourish. Your whole gut ecosystem is upset, and the outside world leaks in across a damaged gut lining. The result is not just obesity, diabetes, and heart disease, but also many allergic, autoimmune, and inflammatory diseases. The researchers explain how giving antibiotics to rats and cleaning out the bad bugs can prevent diabetes. They explain that by adding soluble fiber to the diet, they can increase the population of the good bugs like bifidobacter and decrease the bad bugs, leading to weight loss. But it doesn't just happen in lab rats. I found the same effects when my patients take the special soluble fiber called Konjac Root or glucomannan. The good bacteria feed on the fiber and reduce inflammation. And there's more to the gut story. It seems that you are not the only one eating lunch. The bugs in your gut also feast, and they control your fat storage and the calories you absorb. So people with healthy bugs in their gut lose weight, and those with bad bugs gain weight. Now let me review briefly again the concepts so far so we can look at how they differ from what we normally think about the cause of obesity. When you eat the typical American diet, you promote the growth of bad bugs. They damage your gut lining, they produce toxins, and they're absorbed into your system. Because of the damage, these partially digested food particles also leak into your bloodstream, and then your immune system reacts to the toxins and foods, producing a firestorm of inflammation. That inflammation then leads to a toxic fatty liver, insulin resistance, and leads to higher levels of insulin in your body, which then cause you to store fat, promote disease, and promote aging. So an unhealthy gut makes us fat and sick because it makes us toxic and inflamed. This is groundbreaking research that needs to shake up our thinking about how to help people lose weight and get healthy. Now here are a few simple things you can try if you're struggling to lose weight. 1. Try an elimination diet for 3 weeks. Cut out the most common food allergens, including gluten, dairy, eggs, corn, yeast, and peanuts. Some people are also sensitive to soy, so you can also cut that out. 2. Eat a whole foods, plant-based, high-fiber diet. This is essential to feed the good bugs in your gut and provide the nutrients you need to function optimally. And 3. Take probiotics daily to boost your healthy gut bacteria in your gut. Look for those that contain 10 billion colony-forming units of bifidobacter species and lactobacillus, and choose from reputable brands. Within a few short weeks, even if you did nothing else, you'll see a dramatic difference that comes from cooling off inflammation by healing your gut. Remember, if you want to get rid of that gut, you have to fix your gut.